People always say body fat equals calories in minus calories out, right? And that's always true. But that's not the way it always works, right? Because that assumes that the calories can go in and out of the body fat, which is the storage, anytime it wants. But it can't. What you need to do is
Dr. Jason Fung,
the founder of intermittent fasting,
whose influential work could be the key
to a healthier and even longer life.
Every continent is seeing this increase in obesity, but we put the blame on the individual. The problem is there's something wrong with the message we're giving people, and I can go over a few examples. First of all, exercise is really good in a number of ways, but in terms of weight loss, it's actually a very, very small effect. The whole idea that you need to eat as soon as you get up is just false. We know from twin studies that 70% of your risk of becoming obese is due to genetics, but it doesn't explain why the population became much more obese. And we know that you can't cure obesity by saying eat fewer calories. It's about fixing the hormones that are behind the calories. If you want to lose body fat, you actually need to extend the period of time that you're not eating, so you do some intermittent fasting. There's all this data showing that fasting activates the body. It increases your energy, your concentration. A treatment available to everybody for free, and it will be healthier for us.
Dr. Jason Fung is a leading expert in using fasting and low-carbohydrate diets to address obesity and type 2 diabetes. He has authored several influential books, including The Obesity Code and The Diabetes Code, which challenge conventional dietary guidelines and offer alternative approaches to managing metabolic diseases. As the co-founder of the fasting method, Dr. Fung provides resources and support for individuals looking to implement intermittent fasting into their lives. We've collated Dr. Fung's top tips for evidence-based and sustainable weight loss.
Reduce added sugars. So added sugars is different from the natural sugars that you find in foods by several different ways. One is that you can't artificially increase the amount of sugar. So if you eat a bowl of cherries, there is sugar in them, but you can't keep making them sweeter and sweeter. As opposed to, say, sugary cereal, where you can just keep adding sugar and it will get sweeter and sweeter. And the problem is that a lot of times that sugar is hidden from us. If you read the food labels, you'll find many different names by which sugar comes under. So some people will say sucrose, glucose, fructose, invert sugar, hydrolyzed starch, corn sweetener, high fructose corn syrup. All of those are synonyms for basic sugar. And the reason they do that is so that when you read the label, you don't realize quite how much sugar is contained in those foods. The main foods you want to avoid are fairly logical, so things like sweets and candies and chocolates and cakes and pies and donuts, but also in things like jams and jellies, sometimes in things like peanut butter. There are certain peanut butters that add sugar to it. Sauces are also very high in sugar, so spaghetti sauces, ketchup, barbecue sauces, sweet and sour sauces, they can have a lot of sugar and you may not realize it. Snacks and desserts obviously are going to be very high in sugar most of the time. So those entire sort of times to eat are ones that you want to limit if you're trying to lose weight.
When we reduce our added sugar intake, this leads to lower blood glucose levels and, consequently, reduced insulin secretion. This decrease in insulin allows the body to shift from fat storage to fat burning, aiding in weight loss and improving metabolic health.
Eat moderate protein. Protein is really important to help rebuild your body. Your body needs protein. So there are certain amino acids, which are the breakdown products of protein, that we need. If we don't get it, we're not going to be healthy. So it's very important that we get enough protein. Protein also increases the satiety. That is, when you eat foods that are high in protein, you tend to feel more full. Just like if you were to eat eggs and bacon in the morning versus a slice of toast and jam, the difference is all that protein and all that fat is going to make you feel full for longer. So protein is very important, but it's hard to get too much protein because it's hard to eat on its own. Along the same lines, make sure that you are not afraid of eating natural fats. So for years, we told people to avoid eating dietary fat because it was going to cause heart disease. Over the last 30, 40 years, turns out that advice probably wasn't entirely true. By the 2010s, a lot of people were starting to realize that a lot of natural fats can be very healthy for you, so the term healthy fats became reintroduced. So things like nuts and avocados and olive oil and fatty fish, we recognize that these are very healthy foods for you. Full-fat dairy, for example, may also be quite important to make us feel full, so that when we eat, we're not hungry 20 minutes later.
Dr. Fung recommends obtaining protein from whole food sources such as meat, fish, eggs, and legumes. These foods provide essential nutrients without the additives found in many processed protein products.
Carbs. Okay, so we know that. That's in print. For sure, the American government said eat 55 to 60% carbs, eat less fat. What happened is that, in 1977, people ate breakfast, lunch, and dinner. No snacks. If you wanted an after-school snack, your mom said, no, you're going to ruin your dinner. If you wanted a bedtime snack, your mom would say, no, you should have ate more at dinner, right? No problem. But what happened is that as we started to eat sort of a lot of carbs, what happened is exactly as what we discussed before. You eat 2 slices of bread in the morning with jam. You have no satiety. Insulin spikes way up. Glucose spikes way up. But then it crashes.
So you get hungry again.
Then you get hungry at 10:30. So you go around looking for a low-fat muffin. And it was because, your sugars are going down. Your insulin's going down. So now you're eating mid-morning snack. Then you eat a big plate of pasta. Then you get ravenous at like 3 o'clock. So you go find yourself some crackers or something like that, right? And then so now you're having a mid-morning snack, you're having mid-afternoon snack, then you're having a bedtime snack. And that's the average American by 2003 is eating 5, 6 times a day. But they're saying, hey, I'm eating so low fat. This must be the right way to eat. This must be good for me. So now this snacking becomes institutionalized, whereas pre-1977, snacks are an indulgence, right? It's not something good for you. It's something bad for you, but hey, once in a while you indulge. Then it becomes institutionalized as something that every single one of us should be doing. And we should never be without food for more than an hour and a half. Let's think about this very simply, okay? So if you eat, your insulin's going to go up, your body's going to store calories because you told it to. If you don't eat or if you fast, your body your insulin's going to go down. You're going to bring those calories back out of storage, right? So you're going to burn calories. You eat, you store calories. You don't eat, you burn calories. Very simple. So why would you want to eat all the time? That makes no sense at all. If you want to lose body fat, you actually need to extend the period of time that you're not eating. In other words, extend your fasting period and get rid of all the snacks in order for you to have enough time that your insulin is low. When insulin is low, it's going to allow fat burning, which is going to allow you to pull those calories back out.
Dr. Jason Fung advocates for fasting as an effective method for weight loss by addressing the body's hormonal balance, particularly insulin levels. Insulin, a hormone responsible for regulating blood sugar, also promotes fat storage. When we eat frequently, insulin levels remain elevated, signaling the body to store excess energy as fat. By incorporating fasting periods, insulin levels decrease, allowing the body to access and burn stored fat for energy. This process not only aids in weight loss, but also improves insulin sensitivity, reducing the risk of type 2 diabetes. Additionally, fasting can lead to a natural reduction in calorie intake and may enhance metabolic health, making it a powerful tool in achieving and maintaining a healthy weight.
The funny part about fasting is that there's so many advantages from a weight loss standpoint. So if you do caloric restriction, most people have zero idea how many calories they're eating in a day. It's actually very difficult.
Yeah.
Because if you buy broccoli or steak, you have no idea how many calories are in that piece of steak or whatever. If you fry it up with, butter or without butter, what's sauce you put on it. All these change how many calories you take. So it's a complete guess how many calories you're eating and a complete guess how many calories you're burning. And the amount of calories you're burning actually fluctuates because some people try and measure it. I'm burning 2,000 a day. Well, that actually can go up or down by like 40%. It can go up and down a lot. So you have no idea how many calories you're eating. You have no idea how many calories you're burning. How are you supposed to actually use that as a therapeutic strategy? As opposed to simply saying you should not eat for 16 hours of the day or 24 hours of the day. Oh, well, it's very easy to figure that out. If you only eat once in a day, then that's it. You're following the rules, right? So as a therapeutic strategy, it's much, much more effective.
Incorporating these top tips and fasting into your lifestyle can be a transformative approach to achieving weight loss and enhancing overall health. Dr. Jason Fung emphasizes that fasting is not about deprivation, but about restoring the body's natural balance and addressing the root causes of obesity and metabolic diseases. Remember, it's essential to consult with a healthcare professional before starting any new dietary regimen to ensure it aligns with your individual health needs. If you've already tried Dr. Fung's advice, please share your thoughts and successes in the comments below.